Well, good afternoon, everyone, and welcome to the American Public Health Association of National Public Health Week 2020 Forum. As you know, this is the 25th anniversary of National Public Health Week. And while we have all the challenges that we're having in our nation and really the world today, it's not too late for us to talk about really the future of public health. As you know, the theme is the future of public health is now. So today we're going to have an amazing group of speakers for us to be forward thinking about what's happening in our nation and the world today. So I'm going to start by bringing to the webinar the president of the American Public Health Association, who's just absolutely an amazing person and has been providing a lot of leadership during this time of challenge, Lisa Carlson. Lisa, it's all yours.
Thank you, Dr. Benjamin. I appreciate it. Welcome to everybody who's joining us today. Happy National Public Health Week. We're going to get started this morning with a keynote, or this afternoon, excuse me, with a keynote address, and then we're going to have some panelists who are going to have some conversation back and forth. We'll start first with our keynote from Devin Reeves. Devin is a person living in recovery since 2007. He's a community organizer and grassroots advocacy leader. He's worked on the expansion of access to the life-saving medication naloxone, implementation of 911 Good Samaritan policies, and the development of youth-oriented systems. He wants to build constituencies of consequence that will lead to meaningful public health policy changes around substance use disorders. Devin is the executive director and co-founder of the Pennsylvania Harm Reduction Coalition. He received a Master of Social Work from the University of Pennsylvania School of Social Policy and Practice with a focus on community and organizational change, and has a BA in Human Services from Lynn University. Devin also serves on the Pennsylvania Overdose Task Force and the Advisory Committee for the National Institute of Drug Abuse. You can find the Pennsylvania Harm Reduction Coalition on Twitter, Instagram, and Facebook. And you can find Devin right here. Devin?
Good afternoon, everybody. I hope everyone is as safe and healthy as possible during the COVID outbreak. Let me share my screen here real quick. All right. This, share screen one. All right. All right, hopefully everybody can see my PowerPoint now. Give me a thumbs up, other people on the camera if that works. Awesome. So I'm super excited to be here today. My name is Devin Reeves. I'm the executive director of the Pennsylvania Harm Reduction Coalition. If you're on Instagram or Twitter, go ahead and throw me a follow. I tweet out lots of sassy stuff, so if you're a pro sassiness, you're going to want to go ahead and give me a follow. Like I said, I'm the executive director of the Pennsylvania Harm Reduction Coalition. We are a coalition of all of the harm reduction agencies in the state of Pennsylvania. Our mission is to promote the health, dignity, and human rights of individuals who use drugs in communities impacted by drug use. We do this by increasing the knowledge and capacity of those impacted by social inequity, criminalization, and stigma, educating key decision makers on effective policy and advocating for its implementation, and building community power and leadership through training, outreach, and engagement. You know, we really focus on three things at the Pennsylvania Harm Reduction Coalition, and that's people that are most likely to experience an overdose. So the three communities that are most likely to experience an overdose are people that are using drugs right now, people that are getting out of jail, and people that are getting out of treatment. And we have three kind of separate campaigns that address each one of those, and you can learn more about that on our website. During the COVID-19 outbreak, we quickly tried to shift to move our advocacy machine to respond to COVID for marginalized populations. And we focused on three areas: decreasing the criminal justice population, removing barriers to medication for opioid use disorder, and ensuring that people experiencing homelessness were part of the comprehensive plan. So today we're going to talk about the war on drugs and kind of what you can do about it. You know, the war on drugs or drug policy in America has always been really broken. You know, in our past, we built a transnational railroad, and we had a lot of Chinese people come over and build the railroad. And if you don't know anything about it, I encourage you to like Google and learn some more, because the conditions for those workers were very bad. A lot of people died. They were treated as subhuman. But when the train was done, you know, they coalesced in ethnic conclaves, which represents our modern day Chinatowns. And there's a lot of fear around Chinese people. They were taking all the good jobs. They were starting businesses. They were having power. And white men didn't like that. And so what they said is, well, we can't just make Chinese people illegal, even though we'd like to. So let's make what they like to do illegal. And what was normal in the Chinese culture was to hang out in an opium den and smoke some opium at the end of the day. So they made smoking opium and going to an opium den illegal. So we now kind of can infer from that that the very first drug policy in America was designed to control non-white bodies. And today, you know, in 2020, not much has changed, but let's see how we got there, right? And so this is a newspaper article about the Negro cocaine fiend being the new Southern menace. Murder and insanity increase among lower blacks because they have taken to sniffing cocaine. And so what we do is we attach the idea of a substance to a subpar or less desirable race to make them seem scary and fearful. And so, one, we're dragging down the idea that drugs are bad and also attaching that badness to blackness, right? You know, if we look at marijuana, marijuana is the term for cannabis that really comes from Mexico. And there are all of these, you know, ethnic and kind of negative connotations tied into that. And because I've only got 25 minutes or whatever, we're going to skip ahead to the Reagan era. And he said dumb things like, just say no to drugs. And, you know, of course, you know, there are some people like myself, who probably are going to implode their lives as they lose a lot of drugs. Oh, yeah, I forgot to mention during my intro, I'm a person in recovery. I haven't used any drugs or alcohol for 12 years. That's just what my recovery looks like. Everybody's recovery looks different. And so during this war on drugs era and Just Say No, we really saw a ramping up of a criminal justice response to the war on drugs. And the idea was anybody who uses drugs is bad. And we saw the implementation of DARE. Normally, if I do this in person, I ask everybody to raise their hand if they did DARE. And most people raise their hand. And the thing about DARE is that it's never worked, right? There's 25 years of research that indicates that people who went to DARE and people who didn't go to DARE have the same attitudes and outcomes towards drug use. Yet we still fund DARE to the tune of almost $5 million at the federal level. Fast forward a little bit more, the crack epidemic of the 1980s. So this is Bush 1. This is a screenshot of his address to the nation. You can see it in his bottom right hand. He's holding a giant brick of crack cocaine. And, you know, this picture really says, these two pictures say so much. During the crack epidemic, you know, the black community was just devastated. And the answer to that was more bars, more guards, more jails, more criminal justice interventions. And even the way the media sensationalized the black community with the pictures like the one to the left. You know, this guy looks like he's almost praying at the altar of crack cocaine, right? And then you have the president with a giant rock of crack cocaine that they bought right across the street from the White House. And what they did is they entrapped some poor fool and convinced him to come to the White House to buy it so they could say on this national address, I bought this right across the street from the White House. And really things, you know, as we went forward, didn't get much better. You know, under the Bill Clinton era, we didn't see a lot of progress against the war on drugs. As a matter of fact, we saw it escalate. You know, the thing that I'm most disappointed about Bubba about is that he upheld the ban on federal funding for needle exchange programs, and he did that at the direction and at the advice of his drug czar, which was a military general. And we shouldn't have a military general deciding drug policy and advising the president in drug policy, but almost all of the drug czars, or the official title being the Director of Office of National Drug Control Policy, being cops. They shouldn't be police officers. They shouldn't be generals, because this is a public health issue, not a criminal justice issue. And then we have my main man, Barack Obama. Now, Barack Obama was not perfect. He made a lot of mistakes, but we all miss him dearly. There was really a change during the Obama administration. We saw some excellent bills being passed. Two bills that I want to highlight were the 21st Century Cures Act and the Comprehensive Addiction and Recovery Act. both of these bills were designed to create new revenue streams for states and local communities to address the overdose epidemic and end the war on drugs and really address the war on drugs. Also, during this same time, there was a shift in the psyche of America. So if you don't know who this person on the screen is, his name is Corey Monteith, and he is like this boy next door, handsome white guy. And he was on the show called Glee that was on Fox, and people loved Glee, right? They tuned in every week. These kids sang, they danced, and Corey Monteith, he played a character named Finn, and Finn was the main character in the show. And Corey died of an overdose, and that overdose really was a watershed in the psyche of white America. You know, they were like, "Oh my God, white people die of drugs," and the new face of heroin is young, white, and suburban. Like, you know, drug use was this problem over there. It's in the city. It's on the poor side of town, and this really smacked America in the face, and they couldn't ignore it, right? And that was an important moment in our society and in our response to the war on drugs. Not too long after that, Michael Botticelli became the drug czar. Michael is like my favorite drug policy person ever. He's from New England. He's a gay man. He's in recovery. And he was out there talking about recovery. He was shifting the narrative. He was one of the first people ever to run that office that wasn't a police officer, that wasn't a military general. And we really saw a change in the way the administration was responding to the war on drugs. Also during the Obama administration, we saw the Surgeon General put out a report called Facing Addiction in America. A Surgeon General's report, if you're not familiar, is like a super important thing. You know, the one I think about a lot is the Surgeon General's report on smoking, even though a ton of us still smoke. But this was the smartest people in America coming together to say, what's the plan we should have around the war on drugs? And of course, anything that comes out of the U.S. government is pretty politicized. But this was as non-politicized as I think is possible. It really lifted up the science. I mean, I cannot stress to you all of the smart people that worked on this report. But when 45 was elected, that report really got shelved in a lot of ways. And so we had a new administration and a new plan. And 45 put Governor Chris Christie in charge of his commission on combating drug addiction. And what I can tell you is while Governor Christie is very remembered for his drug policy reforms in the state of New Jersey, his work was so poor that 2 years later, after he's out of office, we're still seeing an increase in drug overdose deaths. So I just point that out to say that I don't think he was the right person for the job, and we already had an excellent plan. However, none of those things really got implemented. And, you know, we really saw a lot of confusing information. You know, this was Tom Price. He was the first secretary of HHS, and he's out there saying medications for opioid use disorder, substituting one opioid for another, which of course is not true. Medication for opioid use disorder are the standard. And you know, the war on drugs has gotten us a huge increase in the prison population. You know, we're seeing so many more people incarcerated, and there's definitely not, you know, that many more people using drugs, right? And the racial disparities in the war on drugs are palpable, right? People of color experience discrimination at every stage of the criminal justice system, right? Nearly 80% of people in federal prisons and 60% of people in state prisons are Black and Latino, right? Research has shown that prosecutors are twice as likely to pursue mandatory minimum sentences for Black people as they are for white people charged with the same offense, right? Black people and Native American people are more likely to be killed by law enforcement than other racial and ethnic groups. You know, we're seeing in our major urban cities in, you know, Chicago and Philadelphia that the Black community is absolutely being crushed by COVID, right? So, you know, all of these social determinants of health people, you know about this, you're thinking about this, and I really want you to encourage to look at this through the lens of the war on drugs whenever possible. You know, and the war on drugs really produces lifelong collateral consequences. It's not like you get in trouble with the law and you get out and you've paid your debt to society. That's not really what happens, right? You are a permanent second-class citizen once you have a felony, right? I have a guy on my team that has a felony, and that is just a weight around his neck in many circumstances. I don't care. I love that he's a felon, because people with lived experience are the people that have the solutions to our problems. But it can affect your voting rights, your child custody, ability to access loans, occupational licenses, public housing assistance, right? And the war on drugs has created this huge increase in overdose deaths, which can be thought about in kind of three waves. Wave one was the increase in prescription overdose deaths. Wave three was the raise in heroin overdose deaths. Wave two was heroin overdose deaths. Wave three is our fentanyl-related deaths. And now we're actually in phase four, or wave four, which is polysubstance use and stimulant-related overdose deaths. Really what it comes down to is, despite paying a lot of attention and money to this over the last couple of years, public health is underfunded and understaffed and under-resourced to respond to this issue, as we're seeing with our response to COVID. And I'm a visual person. This is just a map that shows you per capita overdose deaths over a handful of years. And you could just see here from 1999 to 2015 how much the per capita overdose deaths increased. And in some places, we did see a plateau in 2018, but we're seeing an increase in a lot of those places that saw small decreases back up in 2019. Those numbers still aren't out. And on top of all of that, and forgive me, how much longer do I have in my presentation? I forgot to start my timer. If anybody wants to give me like a, okay, good. Awesome. So while we've criminalized drug use, we've actually seen a concurrent problem arise. We don't have an overdose epidemic. We actually have a syndemic, which I learned from a public health person. That's not a word that they teach you in social work school. And that syndemic is communicable disease and overdoses happening together, right? And so what we have, if anybody's familiar with Mike Pence, he was the governor of Indiana. And when he was the governor of Indiana, there was an outbreak of HIV amongst people who use drugs. And all these public health people, including the Surgeon General, were like, hey, you need to enact these harm reduction interventions. We need syringe service programs. And he's like, I'm not really sure I'm going to do that. The Obama administration had to get involved, the CDC, and eventually they did enact those interventions, though we're seeing a lot of those going away just a handful of years later. And some smart person at the CDC said, what was happening in Scott County, Indiana, where this outbreak happened that, made them vulnerable to an outbreak? And is that secret sauce happening in other places in the country? And they developed this kind of vulnerable counties and jurisdiction list. And what we can see is damn near the whole country is at risk of overdose, at risk of hepatitis C and HIV outbreak amongst people who use drugs. And a lot of these states that are white doesn't mean that they're not at risk. A lot of times it means that we didn't have all the data to collect that. And these pink counties are actually the top 220 in the country. And there's a lot of overlap between extremely rural areas and at risk. You can kind of see all of Appalachia, or huge swaths of Appalachia, are at risk. And most people who work in the drug and alcohol field don't know a ton about hepatitis C, right? So, hepatitis C is the most deadly of all communicable diseases that are tracked, and it's more deadly than the next 60 reportable infectious diseases combined, right? The most impacted populations are young, white, non-urban drug users, right? And we still continue to think of drug use as an urban problem. The other huge problem that we're not talking about is soft tissue infections. Injection drug users is associated with soft tissue infections, vascular disease, endocarditis, sepsis, and a lot of these conditions are deadly and they're very, very expensive, right? We're seeing, in the last, 15 years or so, we've seen a doubling of hospitalizations related to endocarditis, and we just are not paying attention to that the way we need to be. And just in general, the cost of the overdose epidemic in lost lives, in productivity, in jail, is just astronomical. We're talking about billions and billions of dollars being lost because we're responding to a public health problem with a criminal justice intervention. you know? And really what it comes down to is a huge part of that problem is public health advocates like you are not doing your part. And I know that's like hard to hear. Like, who is this Devin guy going to tell me I'm part of the problem? Sorry, it just is what it is. You know, we need you to go talk to your local elected official and become their trusted advisor on public health issues, because most elected officials have to know about cannabis policy and infrastructure and, you know, liquor and just all of these things, and they're not experts, right? But you are an expert. You have an advanced degree, you work on the front line, and if you build a relationship with them, you can be the beginning of change. And it's true, people feel really disillusioned right now. I could tell you during my first legislative visit when I was still in graduate school, I got a legislator to become a co-sponsor to a bill to make naloxone more available, and I was shocked how easy it is. And if you make that little bit of effort, you can make a huge difference. Huge difference. We are living at a critical time in history. You know, while we are talking about how bad COVID-19 is, there's actually two concurrent declared public health crises in our nation: the overdose epidemic and COVID-19. And a lot of marginalized people are going to die because of both of them. And I want to let you know that you all have an extraordinary amount of privilege that you need to sacrifice, whether that's inside of your agency, inside of your community, to make a change. Because a lot of times, you know, people in public health, they lean left, they, you know, they support these kind of social justice values, but supporting them on Facebook and Twitter is different than putting the time in. And I dare say that many of you are not putting the time in your community. And I don't say that to put you down, but I ask you to reflect on where you want to be in this space. You know, 20 years from now, when we're talking about how public health changed after COVID-19, do you want to say that I was on the front line doing everything I could, and then when the crisis ended, I went right back to it and I started advocating to change our broken system, so for the next pandemic or the next crisis, we were prepared? Or do you want to say I did what I did and I went back to the everyday routine? That's up to you to decide. Now, the answer to the overdose epidemic is harm reduction. If you're not familiar with harm reduction, in a nutshell, what harm reduction is it's putting an intervention in place to mitigate the risk of a dangerous behavior, right? People jump out of the airplanes. Now, I don't jump out of perfectly good airplanes. That's just not me. But if we put a parachute on that person, they're 99.99% likely to survive jumping out of an airplane. And when it comes to harm reduction for drug use, it's providing naloxone, providing sterile syringes, condoms, things like that. But because sex, drug use are highly marginalized, are highly stigmatized behaviors, you know, we don't make that available. We don't promote that. We don't fund that. And so when you're responding to any kind of public health intervention, I want you to think about how can we reduce harms, especially to marginalized populations. And when it comes to, you know, harm reduction for drug users, it's really about like everyday interventions like supervised consumption facilities, needle exchange programs, condom distributions, but it's also a social justice movement that looks to really center people that are most affected, and also says that because you use drugs, you shouldn't end up in a cage, right? It's about meeting people where they're at. So many of our systems, you know, we're seeing this with COVID-19, somebody has a cough and they want to get it tested, and there's all these hoops they have to jump through in order to get tested. It's the same thing with drug and alcohol treatment. And right now, if you work in the drug and alcohol space, you're a county commissioner, whatever you do in public health, this is what people who use drugs need right now, right? They need information disseminated to them because they're not checking into CNN. They're not checking into NBC. We need to give them this information. We need to make sure that they are part of comprehensive plans. And I'll make my slide deck available. They'll send this out. I know I kind of ran through this pretty quickly. And we're actually going to do questions after the panel. Here's my contact information. Thanks, everybody, for listening. Get off your couch. Get into the game now, later, forever.
Thank you, Devin. That was really important talk, really timely. I want to go ahead and introduce our panelists, and then, as Devin said, we'll take questions at the end. I see there are already some coming in. So let me tell you about our panelists. Lily Farhang is one of the two co-directors leading Human Impact Partners, which is an organization that seeks to bring the power of public health to campaigns and movements for a just society. For nearly 20 years, she's visioned, developed, and implemented policy and systems change to advance health equity in the government and nonprofit sectors, and she's now responsible for advancing the mission and strategic direction of the organization. These days, Lily is feeling energized by people's willingness to talk about race, power, and other root drivers of health. Originally from New York, Lily now lives in Oakland and is kept on her toes by two little kids in an unhealthy obsession with good TV and the Golden State Warriors. I love it. David Grasso is chairperson of the Committee on Education of the Council of the District of Columbia. David was first elected to the DC Council as an at-large member in November 2012 to represent residents in all 8 wards. During his first term in office, David focused on many issues with one main goal always at the forefront of his mind: making DC a better city. Central to that goal is education. A high-quality public education system and an innovative public library system help residents gain fruitful employment, attract newcomers, and make the city appealing to businesses. He also serves on the Council's Committee on Judiciary and Public Safety, Committee on Health, and Committee on Human Services. He's a native Washingtonian. He earned a philosophy degree from Earlham College and a law degree from Georgetown University. Our third panelist is Dior Vargas. Dior is a Latina feminist mental health activist. She is the creator of the People of Color and Mental Illness Photo Project, a response to the invisibility of people of color in the media's representation of mental illness. She is also editor of The Color of My Mind, a photo essay book based on the photo project. Dior tours the country delivering keynotes, hosting workshops, and speaking on panels. Her work and insight have been covered in media outlets such as the New York Times, Forbes, Newsweek, and NBC News Latino. Dior is the recipient of numerous awards, including the White House Champion of Change for Disability Advocacy Across Generations under the Obama administration, 2015 Alternatives Conference Cookie Grant, and Bill Compton LGBTQI Leadership Award, and a Susan M. Daniels Disability Mentoring Hall of Fame inductee. Dior has a Bachelor of Arts in the Study of Women and Gender from Smith College, a Master of Science in Publishing from Pace University, and a Master of Public Health from New York University. She's a native New Yorker and currently lives in New York City. So panel, I'm going to start with a series of questions. Our first question is, we're celebrating 25 years of National Public Health Week. In those 25 years, where has public health really succeeded? Where do we still need improvement? And how do we get there? Who are we leaving behind? Dior, maybe we'll start with you.
Hi, everyone. Thank you so much for having me. My apologies in not showing my face. I'm feeling a bit under the weather, but I'm still really happy to be participating. Yeah, it has been 25 years, and we definitely have succeeded in many ways in terms of how public health really is a social justice form of advocacy. I think that it's really important that we're talking about how social determinants of health really impact how people live day to day. And so I think that because of those things, public health has really been successful in how it does talk about these unique circumstances for different people. However, there have been some things that it could improve upon. I feel like a lot of times when it comes to people of color, these individuals are not as brought up as much as they should be, even more so when it comes to the studies that are done. A lot of times you're not able to get a lot of people of color to participate, given obvious reasons. And so I think that that's something that needs to be worked on. I feel like a lot of times we've heard that public health has like a public relations or marketing issue. And so I think we really need to work on making sure that we're talking about it in the correct manner. Other things that I've been thinking about is how a lot of times when it comes to disability conversations, it seems like disability and mental health are two very different issues when really they're one and the same. And I think that when we do talk about these issues in tandem, that's when we can really think about how both of the strengths of each group can really complement one another so that we can start tackling these issues in a better way. So I think that, while we have succeeded in many ways, there are a lot of other things that we can do to improve and bring some of those people that we've left behind in the past. But I think that goes with a lot of different industries and issues. And so I think that we're really poised, especially given what we're going through right now, to work together and really focus on how community can help us push forward and really accomplish the things that we really need to.
Thanks. I appreciate your comments, particularly about mental health. National Public Health Week, today's focus is on mental health, which is a great focus to kick the week off, important to public health. David, did you maybe want to add some comments on this question?
Yes, thank you so much, Lisa. You know, I'm really happy to be here and be a part of this conversation as an elected official from the District of Columbia. We have seen the past come forward, I think, quite quickly over the past 7 or 8 in regards to especially the way we collect data when it comes to public health. You know, for years, I think, as Dior rightly pointed out, we were leaving out entire communities when we collected this data and not understanding that we needed to do a better job reaching out and making sure people felt included and actually were included in this process. We're doing a better job of that. For example, in the district, we've expanded what's collected every 2 years in our YRBS, which is the youth suicide prevention work that we do with the Youth Risk Behavior Survey, and making sure that it goes down deep into every demographic in the city and our schools. Unfortunately, when you do that really well, you start to see the reality that so many communities are facing. For example, the number of students who are LGBTQI who have contemplated suicide, who have attempted suicide or planned for suicide, continues to alarm me and continues to grow in our city. And it makes me kind of frustrated that we haven't been able to do more around mental health in our schools because of this. But also it gives me some hope, because I feel like we're finally getting the data we need to make the best decisions as we move forward in the work that we're doing to try to give every student the best opportunity to succeed in school.
Excellent. Thank you very much for those comments. Everybody has a role to play in public health. So how can people in general public get engaged with public health? Devin, do you want to kick us off?
Yeah. You know, I think that we just need to acknowledge that if Did Not Vote was a person, they would have won the last presidential election. And, you know, somehow it became it became cool not to vote, not to care. And, you know, if you've got people in your circle that are like on that game or on that tip, we need to call them in, right? It's not about calling them out. It's about calling them in. And it's about becoming really, really organized and keeping people accountable. When we look at, you know, organized labor, you know, the reason we have a 40-day work week is because of organized labor. The reason we have vacations, the reason we have minimum wage, the reason kids don't have to work in mines is organized labor. But somehow we forgot our collective power. And then we mocked people that said, let's care about the little person. But in the middle of COVID-19, class consciousness has raised so much. You know, everybody looked at the $1 trillion, you know, bailout for the banks and was like, what? Like, and at the same time, you know, we're seeing that the person that helps us get our groceries is a vital worker. And so we need to take steps after COVID-19 to talk about public health all the time. We cannot let them forget ever how we were understaffed for public health. I don't know about anybody else here, but my friends are getting sick and dying because of COVID-19. And we can never let them be forgotten, because they will die in vain if we don't push public health forward. So all the things I talked about in my presentation, get to know your elected officials, consider running for office, get involved with your local party, you know, be the champion for public health.
Great. Lily, you want to add some comments to that?
I do. Hi, everybody. It's nice to be connected with everybody virtually. And as I do with my staff in almost every meeting, I have to apologize in advance for knuckleheads that are probably going to burst into the room that you will hear in the background. So bear with me, the hundreds of people who are on this. So I want to just actually bridge the two questions that you asked, Lisa. I think there was this question around like where we succeeded and where do we still need improvement? And I think, and then how to get people to connect to us, like the general public sort of engaged in public health. And I actually think that like where we've succeeded is that I think there's widespread understanding in our field that the social determinants of health are a large part of what produces health. I think what's missing and where we need improvement is actually a theory of change around why there are inequities across all of the social determinants of health. So it's not like if we just reformed our educational system or just reformed our criminal justice system, or emphasized policy and advocacy and systems change efforts in those sectors, things would be fine. They're not, because each of those systems has their own underlying inequities. And so one of the things that I think public health could do to really improve is actually analytical, is actually starting to think about systems of advantage and oppression, structural racism, and how it connects to white supremacy, sexism and how it connects to patriarchy, class differences, income differences and how they connect to classism, starting to actually think about what is even upstream of those, and then what are in addition to these systems of advantage and oppression, the purpose of them is really to uphold these unjust power imbalances that leave people completely disenfranchised and disconnected from institutions of governance, which we'll talk about a little bit in a minute. But what I want to say is that I think if we improved our analysis, people would, in other movements who are organizing, would actually come to us more. Right. So I think that I think we could outreach and get people engaged in public health, but there isn't a way in which we have to prove our mettle. We kind of have to prove that we know what the root drivers are, that we're willing to put our lives and our authority on the line. And I think if we're able to do those things, and again, we can talk more about this, people in the general public would engage more with public health. So I think what we need to think about is how do we make ourselves as a field more connected to other movements that organize and mobilize people to get engaged in policy, systems, and practice change.
Great, thank you very much. David, do you have some comments to add?
Yes, thank you. I really appreciate those comments. And, as a elected official here in the city, I think about the role of advocacy all the time. Frankly, I can't do the work that I do without strong advocates, without people coming from all walks of life into my office, inviting me out into the community to learn what is the best thing to do for our city. And in fact, it evolves all the time, depending on the issue. Who can get in and who can't is really important. But the role that is played by advocates, I think Devin said, politicians are easy. I think that's true. We're looking for any kind of valid, informative information to help drive the work that we do in our offices. And so coming in a meeting, sending letters, sending emails, all that makes a difference. And I'll give one concrete example. The reality is that the District of Columbia had an out of school time office that had completely fallen apart. That means the after school summer programs were no longer operating. We were looking to try to revitalize this area in our city, put a lot of money towards it. We're talking 20 million or so a year to support these programs. I couldn't do it on my own as a politician. My colleagues all had their own priorities that they were working on, but we got the groups in the city that cared about these issues, the groups that worked with these youth, the groups that actually wanted to see these programs in place, mobilized. And when they mobilized, they came in and met with us. They put demands on the table. We recreated the Office of Out of School Time. We have a commission that's been formed, and we fund it now, like I said, for over $20 million a year. And so this is something that we have to get to the core of why you want something done. You have to be able to express it in a way that can be understood by everyday people in a really meaningful way. And then when you bring this to a politician, you have to demand that they listen. And that is the hardest part, I think, is demanding that they sit down and listen to you. And the way that you can know that they listen is if they turn around and do something that you requested of them to do. And then I think you will see change. Thank you.
You bet. Dior, would you like to add some thoughts?
Definitely. Given what David was saying about advocates, I think it's extremely important that, while you may not have a certain degree of education or anything like that in order to be maybe viewed as a public health professional, there are a lot of things that people can provide in terms of like lived experience. Even for me, even before I had received my master's in public health, I very much used my personal lived experience to see how I could contribute to the field of public health. And I think that given that a lot of times the data does not include people of color or other marginalized communities, I think that when you include the lived experience of others, that is what can really complement and humanize things that maybe people might not be able to visualize. And so it really makes it more tangible. So lived experience is just something that is extremely important. I think that that's very much what everyone could be contributing to how public health really impacts every single individual.
Excellent. Our next question turns us to the coronavirus pandemic. As the pandemic continues, we're sometimes seeing conflicting information about the virus. Who should we trust, and what do we do when public health leaders are giving conflicting advice? Lily?
Yeah, I have such a strong reaction to that question. And I feel like in some ways, the roots of that question kind of require kind of a deeper understanding of our political determinants of health. And so, I don't blame public health specifically for giving conflicting advice, right? Like, if you look at the data coming out of Germany, one of the hypotheses for why the COVID-19 death rate there is so low is because people have strong faith in government and in their leaders. And so they've been able to kind of comply with recommendations. They've also done more as a state to support people surviving through this crisis. And we have just the opposite here in the United States, right? We basically have a neoliberal system that emphasizes free markets, small government, and individualism. And so what we're seeing is that these values and these narratives are placing people at higher risk. This neoliberal model has sacrificed worker protections. It's sacrificed our healthcare system. It's sacrificed our social safety net. We've had this series of myths here in America about self-reliance and government being bad, and we're basically paying the price for that right now. So it's not an accident to me that people don't trust government, that there's conflicting advice coming out, but really to me, the underlying issue is that people, we sort of trained them through our narratives, really starting in the 1980s, and I give props to Devin for some of what he was talking about in the Reagan era and the war on drugs. I think accompanying that war on drugs was really an intentional effort to reduce people's faith and trust in government writ large, to throw government under the bus as inefficient, as wasteful, as scary. And it was wrapped up in, a healthy dose of racism and xenophobia. And so here we are with high levels of mistrust and confusion, right? We've systematically disinvested in our institutions of governance and in our public health systems. We've intentionally avoided a centralized public health authority because we have this peculiar devotion to state and local rights. And layered on top of all of that is people's lived reality that our government institutions have failed them, right? Like Devin did a great job talking about how they've basically failed Black and brown communities who are over incarcerated. They failed families who are being separated. They failed people who can't afford their homes. And so between people's lived experience of their institutions of governance actually failing them and narratives that have been sowed by the right, here we are. And so when you ask who should people trust, the answer isn't so easy. And I think to make people believe our public health and government institutions, not only now in this crisis, but in the future, we have a lot of work to do. And I'll just focus on public health to repair the harm and to show our value, to show up who we stand with, to change what we stand for. I think we have to make a deep, deep investment in an altogether different narrative. And I realize that that's not necessarily the specific answer you're looking for, like who should we trust in this moment? Should we listen to Dr. Fauci or should we listen to Dr. Gupta or whatever it might be? But the future of public health, I think, really has to be about this widespread narrative change and about, I think, repairing the harms that we've inflicted if we want our voice to be trusted going forward.
Great comments. Thank you very much. Devin, I'm going to turn to you with our next question. How should we all protect public health workers and advocates right now?
I think that, we're hearing a real focus on hospital staff. We want to make sure that hospital staff have the protection equipment they need. And I agree 100%, but we need to really raise the awareness of who is a frontline staff and who is vital right now. The person that sells me my groceries that many people in America didn't want to make $15 an hour is vital. Just as important as a nurse, right? My wife is a nurse. She goes to work 3 days a week and takes care of little kids. She is the best. I love her, right? But I also really need the person that sells groceries. I also need the person that does homeless outreach to people who are unstably housed and connecting them to resources. And the truth is that people that are delivering our Amazon packages, people that are doing our groceries, and people that are doing working with marginalized populations have no PPE. They don't have masks, they don't have protection, and an outbreak in any one of those non-vital vital systems would totally destroy a community and would lead to astronomical amount of deaths. So I want you to encourage to each one of you to call your legislator, whether that's your local city council person, your state rep, or your state senator, or all of them, and say, hey, as a public health professional, here are some concerns I have. You could literally send a 5-minute email after this, copy and paste, write an email for 5 minutes and then send it to a handful of people just to have them thinking about this, because legislators, like the rest of us, all of us, our heads are spinning. We're doing the best we can. But if we're not thinking about the most marginalized people, if we're not thinking about the Black trans woman and how she's going to survive this, then we're not building systems for everybody. Listen, upper middle class white people are going to be fine. They got health insurance. They can socially distance. All those communities that can't, they need to be provided services for. And it's up to you as a public health expert to change, to highlight that and to advocate for that.
David, I'm going to turn to you with our next question. How has COVID-19 revealed or highlighted other public health crises or holes in our public health infrastructure?
This is kind of an interesting question because it kind of goes through the theme of this entire conversation. I think Lily is really primed the answer here with her thoughts. The fact of the matter is that we have a public health crisis. We have a public health issue that is so big because of the disjointedness of our governments. And the fact is that whether you're local trying to work with local, or state with state, or federal with local, you can see just how disjointed everything is. And I can give an example of this. We are right here in the nation's capital, in the District of Columbia. We have Maryland and Virginia on either side of us. We have the federal government right on top of us on a regular basis. But yet, the District of Columbia doesn't get the same kind of support that the other jurisdictions are getting from the federal government. We also do not have the same kind of coordination ability because of our second-class status, where we don't have 2 senators in the Congress. And the fact of the matter is that we could do so much more if we just simply collaborated better with each other on all public health matters. So whether or not we're talking about gun violence, whether or not we're talking about housing, hospitals, where our hospitals are and how we build them, can we not talk about this as one community? And I think it's just too bad that our country has been developed in such a way that we are individualized, and it goes towards the state structures as well as towards individual people trying to make decisions about their own lives. And we're not about the whole community as much as we should be. And I'm not just saying, oh, we should become a socialist, government or something like that. What I'm saying is, at the core of the decisions we make as a government should be those amongst us who have the least. And exactly what Dan was saying, we shouldn't be making decisions about what will help the people who have what they need to survive only. We should be investing in the people that are most often left behind, and that will give us the answers that we need from a public health emergency or from everyday public health needs that we need in order to get this society in a place where we can be confident that the kind of collaboration that we need to do to survive as a human race is possible. And I'm frustrated by it every day here in the District of Columbia because of the failure of people to listen to us, but also the failure of our surrounding jurisdictions to even bother to work with us in a meaningful way on the things that are most important, like I mentioned before, affordable housing, gun violence, where we locate hospitals, education, mental health services in our schools. Anyway, this is something that frustrates me. I think the crisis only exaggerates all of this and shows it in a way that is so obvious to us. I mean, we give our daily numbers on the coronavirus impact on our community. For the first 3 weeks, we talked about DC alone, and Virginia talked about Virginia, and Maryland talked about Maryland. Lately, we've tried to coordinate a little more where we're talking about the region, and you'll start seeing that reported in the press, because it's not like somebody goes to the Giant only in the District of Columbia to get their groceries. They go to where they are closest at that time. They might be in Maryland, they might be in Virginia. That's true across this country, and I think we all need to step up, break down the silos, and work more together to resolve this crisis, but also to not have any more in the future.
Thanks. Diora, would you like to add to that?
Absolutely. I've seen so many things that have fallen by the wayside, and there's so many things that people do not have access to that should have been obvious, but given what's going on at the moment with the virus, it's just been made painfully clear how there's a huge lack of resources for so many different people. And to be more specific, when it comes to education and when it comes to students, particularly in New York City, where I'm from, there are so many things that are happening to our students. There's tons of lack of resources when it comes to Wi-Fi, internet access, even having devices to connect to those services. So there are a lot of students who are in foster care, who are in shelters, who don't have Wi-Fi. So regardless of where they are, they're just not receiving these resources in order for them to continue learning, because a lot of these schools have closed. And so now they've moved to online learning. And so with lack of devices, lack of internet services, these students can't continue to learn. They're going to fall behind. If they're seniors, then will they be able to graduate? A lot of these students will be first generation students, and a lot of their families are really depending on them. It's really like a rite of passage for these families, because a lot of them haven't had a graduation in their families, and because of this virus, they've lost that opportunity. And a lot of people have been putting so much effort and hard work into this, and so that's just one of the things that is really stolen from these individuals. Another thing is people who live in volatile situations where they're experiencing domestic violence, where now they have to stay in place and live with someone who is, let's say, very abusive towards them. And so having to be quarantined with someone who you don't feel safe with, that's something that is unimaginable and just sounds extremely horrible. And so the fact that those abusers may be surveilling their internet history is just very much the personal political. Whatever people are going through personally, it really shows how politically things are not being taken care of for these constituencies. And so I'm really concerned about how we can take care of these people who don't have these resources, and things will continue to get worse unless we really try to buckle down and see how we can help these individuals. So I'm hoping that there can be some sort of drives where people can collect devices that maybe you haven't used, that you haven't recycled, that maybe you can make that available to students. There's a bunch of things that I think we could start doing. We just really have to go ahead and do that. So I just really hope that we start making a difference in people's lives, and that if something does happen like this in the future, that we will be prepared, and so people won't be in these dire circumstances again.
Great. I have one more panel question before we turn to the questions from the audience. So our final panel question, Lily, is for you. What do you see as upcoming public health challenges in the next 5 to 10 years?
Yeah, I think, I started to talk about that kind of earlier when I talked some about kind of the narrative shift that needs to happen in the next few years, and kind of what our role is in leading that change. And I want to share a quick story because I think it's actually a good kind of bridge to the last question that was asked that you did such a good job answering. So I got my start in public health in 1999. My first job was at the New York City Health Department. I worked at the commissioner's office, and then 4.5 years, I got my master's degree, and then 4.5 years later, I moved to San Francisco, and I started working at the health department in San Francisco for 7 years. And we started to work on this project in 2008 with advocates in California around paid sick days. So worker justice advocates in California wanted to push a bill in the state legislature that would require employers to provide their employees with paid sick days. And through some personal connections, we got connected to those advocates, and we started chatting with them. And at this time, I worked at the health department in San Francisco, and we started chatting with them about paid sick days and their campaign. And we talked about how, we regulate restaurants here in the environmental health section at SFDPH. We'd actually never checked to assess like whether or not people who work in restaurants, if they're sick with norovirus or the flu, and they've been, we've asked them to basically socially distance in order to comply with whatever the requirements are. We don't actually check to see if they have paid sick days. We don't actually know whether they can comply. So at the health department in San Francisco, we initiated this project with Human Impact Partners, the organization I work with now, and with advocates in the state to study the effects of paid sick days on people and whether or not access to paid sick days would improve their health and would contribute to halting kind of the spread of communicable diseases in places where people congregate. So, it was a novel project. SFDPH had not done anything like that until that point. And then fast forward, like over the next 3 to 4 years, we did similar projects in New Hampshire, in Maine, in Denver. And we would go to the health departments. At this point, I worked at Human Impact Partners. We would go to the health departments and we would beg them to get involved. We would say, can you please share your data on norovirus outbreaks? Can you please kind of go on record in this press release? Can you please make some comment publicly about how paid sick days are important for public health in order to comply with public health recommendations? It was so hard to get public health departments to go on record. And I'm not, I worked at public health departments. I'm not trying to throw my brothers and sisters that work over there under the bus. I'm just trying to say that they couldn't go on record. The AMA, we reached out to the national AMA. We reached out to state AMA in California. They wouldn't go on record saying that paid sick days. Again, this is in 2008, 2009. The point of my story is that we are now reaping what we sowed, right? As a movement, we chose to sit on the sidelines because it felt too controversial to fight for worker rights and to say that workers need paid sick days as a public health prevention strategy, okay? And now we're faced with a situation where the lack of paid sick days, and of course there has been local and state action since then, and California now, they give workers 3 paid sick days. We're so generous here in California. And of course, people are making moves and public health is caught up, and there's you can see Trust for America's Health and the DeVomont Foundation and others are talking now about paid sick days as a public health prevention strategy, but 10 years ago they weren't. And so what I want to say is that so great, I'm glad we're on board when it comes to paid sick days. What about universal basic income? What about, paid family leave in every state that covers businesses of all sizes, not just those that are bigger than 500 employees, right? Like these struggles for housing justice, these struggles to close jails and prisons, these struggles for immigrant rights and immigration reform, like these people in those movements are clearly seeing themselves as part of a wider social justice fabric. They're in alliances together, they're protesting together, and by and large, public health just is not in that space. And I think there are pockets, right? I think there are people in public health that are showing up to advocate for progressive policy change in those sectors, but like here we are living through this pandemic where the widespread lack of paid sick days is like undoubtedly an independent variable that's contributed to the spread of the virus. And I just can't help but wonder, like, what if we stood up for workers more? What if we stood up for renters more? What if we push policy change in those sectors in the way we push breastfeeding and smoking cessation? Like, what would it mean to say, like, let's close jails in the same breath that we say, like, moms should breastfeed? And so I don't totally know what it is about our field, and like I said, I've been in the field for over 20 years. Like I have not left public health from the day that I started. I don't know if it's this professionalization or this way that we've like research and equity and the myth of objectivity are so intertwined with how we work. I don't totally know what's led us to being set apart from people and movements who fight for equity and justice. But what I would say in response now to your question, Lisa, around like what is the upcoming public health challenge in our time, it's really about shifting mindsets where we believe in this perspective that all of our well-being is wrapped up in each other's well-being, and that it's our responsibility as public health to join our sisters and brothers in movements for social and racial justice. We have to use our voice more. I think that's our challenge. And I'll just make a little plug. One way you can get involved is through an organizing network, Public Health Awakened, that Human Impact Partners created in 2016. The idea is to really get public health people more directly involved in supporting social movements. And we are doing a specific thing actually around National Public Health Week specifically, where we're taking each of the themes of the day and adding some advocacy and actions on social media. You can follow us on Twitter at PH Awakened, and we're on Facebook too. We're hosting 3 discussion calls for public health folks to connect around some of the themes. You can find out about those themes in our social media also. So essentially what I'm saying is that in the next 5 to 10 years, y'all need to join these movements. That's our call to action.
Great, important comments. Thank you very much. I'm going to turn us now to the comments and questions from our audience. Devin, the first one is for you. So for people who work in other parts of public health, like something like school nutrition, how would you suggest that they could get involved in your field?
Yeah, I mean, everything is wildly intersectional. So let's just take working at schools. We have a kid that, when I think about, nutrition in schools, this kid wasn't doing well in class. And the reason the intervention they needed was they needed food, right? And we need to say, all right, let's take it one step beyond the presenting problem of they need food. Mom and dad need a job. Mom and dad need skills training. Mom and dad need stable housing. And always bringing an intersectional conversation and analysis to the problem is really like the next step. And you may already be doing that. And if you're already doing that, there is a local organization that shares values with you, that shares your hope for the future, and get involved. And that may be, I'm going to volunteer. I'm going to join a board. I think a lot of Lily's suggestions were really good. We're in Pennsylvania. If you're in Pennsylvania, there's a Pennsylvania Harm Reduction Coalition, but there's like 20 of us, right? There's an Iowa Harm Reduction Coalition. There's a New Jersey Harm Reduction Coalition. There is HIPS in DC. There's the Baltimore Harm Reduction Coalition. I mean, the cool thing about harm reduction organizations is that they're very intersectional and they always need a lot of help. So it's 5-6 hours a month or a year could make a huge difference to a small nonprofit and advocacy organization. Find out what calls to you and get engaged.
Great, Devin. This next one is for you too. How would you answer a question about the tricky balance between, say, kicking an adult child out of the home for smoking meth, which creates a new homeless human, versus making the home a safer place for the folks who still live in it?
Yeah, so I have this like circle thing. So what I say to parents all the time is, sit down and write a piece of paper and draw 3 circles in it. And the outermost circles are behaviors that you and your loved one feel really comfortable about doing, right? So it's eating food together, watching TV together. The second circle, the middle circle, are like riskier behaviors or maybe sliding towards risky behaviors. And those middle circles may be taking that person to buy drugs or giving them money to buy drugs or, somehow, other people call it enabling behaviors. I don't really believe that's a thing. And in the inner circle are these are behaviors we don't want to have happen in our house ever, right? And so that may be using drugs in the home or bringing other people over to the house to use drugs. And that's really a personal kind of activity you need to do together. But, what I'm encouraging people to do is to center health, wellness, and safety, both yours and your loved ones. And if you can keep them in your house, I think that's awesome, or connect them with other housing options. But the truth is there's so many holes in the safety net that people who use drugs actually need that if you kick them out, they are going to be homeless and they may be more likely to die. I think it's a little bit different with methamphetamines than heroin, and it's worse in America than other countries. But that's a personal decision. I encourage you to get kind of as much help as possible. I'm on social media. Feel free to reach out if that's you or a loved one and you want some more information.
Devin, related question. Do you think that youth-oriented interventions, say 13 to 25 years old, in schools for substance use are an effective approach to the high incidence of prescription drug use and overdose in the U.S., especially in non-urban environments?
Yeah, I mean, so, what we've done is we spent a lot of time on prevention. And the prevention message traditionally is don't use drugs. But most people who develop a substance use disorder start experimenting with drugs in their teenage years. And so what we haven't developed is a way to intervene early on people who use drugs. And once they develop a chaotic or problematic problem with drugs, we don't have a way to support them, right? In Pennsylvania in the last 5 years, we've lost almost all of our adolescent treatment centers, right? There's only one adolescent treatment center in Philadelphia. one in the central part of the state and one in Pittsburgh, when there used to be almost a dozen. And that's happening across the country. And once a young person gets into recovery, how do we help them develop a new community of other people that are on the same tip they are? And you know what? You can't bill public health insurance for pro-social activities. And most young people that are in recovery just need something cool to do that's not around drugs on a Friday night. And so we need to change the way we invest in our programs, the kind of programs we fund. And yeah, I do think that prescription pills are a huge part of it. But in general, prescription pill related deaths are going down. And we should be more concerned about some other substances, especially in our young population. And somebody may lose their marbles about this, but I don't think vaping is the disaster that everyone says it is. I think that while vaping isn't great, young people did smoke cigarettes. And I think there are things that are actually killing people right now that we need to spend time, money, and attention to, like gun violence, for example.
I'll open this next question up to the entire panel. Our audience member says people aren't talking much about maintenance and custodial staff being essential staff, but these folks are just as much on the front lines as doctors and nurses and can't call in sick or not provide a PPE to do their jobs. And our audience member asks, where's the advocacy for them?
I'll just throw one comment in that in many places, a lot of those folks are part of unions or are part of workers' centers if there are not unions. And so, and the truth is that a lot of those folks are folks of color and immigrants. And so in some ways, the advocacy is actually coming from sectors that we're not necessarily connected with. So workers' centers in, all over the country that might support warehouse workers, Amazon warehouse workers, or that might support restaurant workers, like the Restaurant Opportunity Center. They are doing that advocacy. And I think that it actually behooves us to be reaching out to local worker centers that organize those folks to get a sense of what their needs are. And so, I don't quite know what the best way is to help people learn what the worker centers are in their local areas. But most major, cities have them. You will see even statewide organizing coalitions that organize people in low-wage work. And so I think reaching out to those sectors and trying to understand what the needs are is one way to try and connect with folks that I think are on the work margins right now, for lack of a better term.
Great, thank you. Our next question is going to turn us to today's focus of National Public Health Week, mental health. It's a subject that's near and dear to my heart, and our audience members asking us if we can directly talk about the challenges we're facing in the realm of mental health in this country.
Can I encourage my colleague Dior to jump in on that?
Yeah, Dior, we'd love to
Yeah,
hear
I was going to encourage Dior.
Yes.
Dior, and also Lisa, if you have something to say, please, you should share that if you have knowledge to drop.
Dior, let's start with you.
Yeah, I definitely understand the need to want to have a break from COVID-19. I guess it's just hard not to think about it given this time, especially when there's a lot of, there's the need for quarantine, for isolation, and that has a huge impact on people's mental health. Even mine, I've been struggling because, a lot of people do need to have that face-to-face conversations, to have that connection to community. And so mental health is a huge part of it because we are in isolation. But trying to think of things separate from COVID, just, how important it is that we do continue to spread awareness surrounding mental health. I think that that's one of the main things that I think that we can continue to work on, regardless of who we are in the world. And also because, yeah, awareness is great. I think we also need to figure out how we can make more strides by volunteering, by helping people out, by doing so many other things. Because I think that, awareness is wonderful, but it's also about seeing how we can make policy changes to make sure that people can get the mental health care that they need, one that is accessible, one that is culturally sensitive, culturally compassionate, one that has mental health professionals who are of color, who are understanding of people's multiple identities. And so I think that that's something that we I think as whoever we are, as social workers, as public health professionals, as anyone can really try to fight towards and share resources with others. I think that given what's been going on, I think that we're really trying to find different ways, specifically virtually, that we can provide support to others, given that people either can't leave their houses or things are not as available as they were before. So those are just some of my thoughts. And yeah, mental health is just, it really is at the forefront of everything that's been going on lately.
Yeah, I agree.
I can add in here.
Oh, go ahead, David.
Sorry, go ahead, Lisa.
Go ahead, David.
I just wanted to tie in the role that I play as the chair of the Committee on Education and how worried I am about access to the behavioral health services that our students need. You know, we've built out a program in the District of Columbia to try to expand the number of professionals that are working in the schools one-on-one and in small groups with students. And we've done it very deliberately based on need, based on the amount of adversity and trauma that students experience, and also based on the reality that we know to be successful in school, students who have experienced multiple traumas or adversity in their lives have to have a resolution to that really before they can be successful. And that is something that we've seen with our academic results in the city. And so I worry very much that as we do distance learning and our students are not personally connected to the schools, they're going to get food because we're making sure that they continue to get the food that they need with pickups and drop-offs of food. They're getting the education as best we can because we're doing distance learning with packets and online stuff. You know, they're going to get certain other things, but are they going to get the kind of mental health services that they need to be successful when they're at home? And the answer to that right now is no. And that worries me tremendously. I would love a place where we could give full service behavioral health programs to every single student who needs it in our city. And we're still not there yet to begin with, but I believe that this is going to set us back quite a ways on this effort. I mean, the district alone is looking at cutting $670 million out of our budget just for this fiscal year up until October 1. So what's going to go first? The things that we were last, you know, basically promoting last are the things that will be gone first. And since we didn't understand the brain science, we didn't understand what students actually needed to be successful academically for so many years, my fear is that we're going to take that money, which is not a lot of money. It's like $12 million a year. It's not what we need to be investing anyway. And we're going to cut it. And, you know, frankly, we talk a lot about the achievement gap in this country now. We're talking about the disparities in our educational opportunities. And the fact is that one of the reasons why there are disparities, and it's a major reason, is because students who grew up in poverty, particularly Black and brown students who live in poor communities, do not have the mental health services they need to get past the trauma that they experience on a daily basis. And that worries me tremendously and right now, but it does regularly, but now even more so.
Well said, David. I think one of the messages I'd like to get out this year as I'm hopefully get back to going to visit our affiliates is that mental health really is essential to public health. If you think about the kinds of the social determinants of health that are the things that writ large, like social structures that foster income inequality, community stressors, things writ large like poverty that have such an impact on health, all of those things impact mental health as well. And so really trying to encourage public health professionals that whenever we talk about public health, that we talk about mental health too. And that's, I think, particularly important right now in a time of COVID-19. I was invited to write a short piece on that for Public Health Newswire, which went live today. So if folks are interested in that, you can take a look at that. Well, we're thinking a little bit about how we work cross-sector. We have a question about that. As public health professionals and social workers, it seems like social justice would be a main viewpoint for both groups. How could both professions work together to create change? Devin, it seems like maybe we should start with you.
Yeah, sure. So, you know, I think that this should really start at the undergraduate level, right? We should start, like, I went to college, back to college at 25 after I found recovery. And one of the best parts about going back to college was starting a student group. And, you know, we should be starting student groups at colleges that are about social justice and health, and social work students and public health students and our like pre-med students. Like, let's get them involved and let's start seeing that cross-pollination happening early. I think you could start, like, you know, Penn State has an alumni association where you could start a subgroup inside of that. And that's another opportunity. You know, we know that because people don't understand public health and don't understand social work, a lot of times public health and social work professionals are working together collaboratively at the same agency. And it's about saying like, hey, what's the social work perspective on this? What's the public health perspective on this? And really try to sit back and not just being like, what's the next thing I have to do, but having an analysis of the problem and then saying, here's the solution. And that's hard to do. We're working 40, 50, 60 hours a week, especially during the COVID crisis. But if we don't have those like thoughts and analyses down, then, we don't even know if what we're doing is the right thing. I mean, a solid example is, warm handoff programs were started to respond to people who were ending up in the ER post overdose, and hospitals were staffing them from 9 to 5. But if they had, really thought about it, they would have realized most of those overdoses are happening at night, not when it's easy for the hospital. It's not about when it's best for us. It's about what's best for the people.
You mentioned students. I want to open that up to the whole panel. What are the ways that students can get involved right now in the crisis of the moment, certainly, but in the challenges of the future for public health? What would you say to the students who are listening today? Lily, you want to start?
Yeah, I mean, so it's hard because students, while they're in schools of public health, they're like, I would say that their primary source of power while they're in school is their organizing power and their ability to demand kind of attention to important topics and issues from their administration. So I do think there's like a self-organizing that can happen. And there's a lot of like Black Lives Matters, groups at schools of public health, for example. But actually what I'm sort of curious about is how can you shift the School of Public Health itself and the Association of Schools of Public Health specifically to kind of widen what is required learning of public health students. And so what I think about is like, why isn't it required that students they take advocacy, for example, classes where they learn how to lobby, they learn how to analyze public policy. A lot of the students that I know from like our local school of public health here, like they often have to take a policy analysis class at the public policy school, right? And so what is it about how we can actually, and that may not be true at every school, but like what is it that we can do to actually shift what the baseline requirements within schools of public health are to lift up social justice and kind of lift up advocacy and organizing as key public health prevention strategies. Like I know that schools of public health still require like that 3 kind of program design class, right? Like design your program, get input, evaluate your program. And it's like over 3 courses and you're like, oh my gosh, like we don't actually do like, we're not trying to push individual program design, program change in the same way as a field. And so so to your question, like what can students be doing or what can we, how can we get schools of public health and other institutions of higher learning to be more responsive? I actually think it starts with an accountability campaign and to basically say like, you're training us and you're not setting us up to be able to do the structural reform that actually our field calls for. And, like a lot of times we get interns at Human Impact Partners who come and they're like, this is not, and I think it's true for most organizations where they're like, oh, dang, I learned more kind of in the 3 months here about like what the skills are to make change than what I learned in my classes. And I love, again, like I have an MPH. Clearly I was influenced in a good way by my, instructors. And so it's, again, I'm not trying to hate. I'm just trying to say that there is a way to increase kind of the accountability and responsiveness to what the needs of the moment are in our curricula. So that is just a quick thought, or not so quick thought, that I have on that question.
While we're talking about students, just want to remind all the students who are out there that we have a student day panel at 5 p.m. on Thursday, and I'll be there, and I hope you'll be there too, to talk about all things student and public health. So come and join us for that. Any other comments from our panel on students for the moment?
Yeah, I would say grab these young students and put them under your arm and start radicalizing them right now. I have somebody that's interning us next semester. Her name's Catherine Zuck. She's getting a MSW MPH from Temple, and I know she's watching right now. And I want to say is like, invest in that next generation of change agents. Like I wouldn't be where I am right now if I didn't have mentors and people that took a chance on me. And you have to do that, right? There's some kid that like went back to school, has a criminal justice record, and we don't take those people at our agency. Get rid of that rule, take those people, let's start investing in the next generation, because if we don't, they're going to go get like jobs at Deloitte and other weird places, and they're not going to be engaged like we are. And nothing, there's anything wrong with Deloitte, but it's not as good as what we do. Let's just be honest.
And this question might be for you too, this next one. Especially during COVID times, we can't afford to overlook substance use disorder. Should we view substance use disorder separate from mental health, or does it get glossed over? It's more sort of something to discuss there.
Yeah, so, mental health is the big umbrella, and substance use disorder is under that umbrella. Even though it's a very specialized thing, in our government, in our funding, we've disempowered mental health and substance use disorder by making them two different funding streams. So mental health goes, forget substance use disorder, we can take care of that. And substance use disorder goes, forget mental health, we can take care of that. 50% of people that have a substance use disorder also have another co-occurring substance use disorder or a co-occurring mental health concern. And so you cannot pull those apart. And what it comes down to is we actually need to revamp our entire educational system, because people get a lot of training, they become LPCs and these other master's level degrees, and they know nothing about substance use disorder. And that's a huge problem. I mean, as a social worker, I am all over, the Council of Social Work Education, the National Association of Social Workers. They need to do a better job teaching the next generation of social workers about substance use disorder, because 70% of all kids that are removed from their homes are because of substance use in the family. And that is just an extension of the war on drugs. And if we don't teach people a humanistic view of drugs and drug use, we turn social workers into cops. We turn public health people into weapons of the state. And we need to stop doing that. People who use drugs are not bad people. Just like people who have mental health concerns aren't bad people. But still, the number one provider of mental health services in most communities is the prison. The largest mental health facility in the country is Cook County Jail. We need to really, destroy those systems and build up new systems.
And thinking about how our systems can help, some of the strategies to deal with COVID-19 are layering on trauma for vulnerable populations like intimate partner violence, child sexual abuse, elder care abuse. Our audience members asking how wellness checks or telemedicine can respond, maybe some more of our cross-sector collaborations. Would one of you like to talk a little bit to that? It's a tough one.
I'm happy to start it off, but I certainly don't have any answers here. The fact of the matter is that we have been desperately worried in the District of Columbia about these issues, although I'm not sure we have a perfect answer about doing, wellness checks at homes or doing, making sure that people can get access to their behavioral health technicians or workers or psychologists. And one of the things that frustrated me very early on was that we asked the simple question. The mayor was doing in DC regular calls with the council, which I really appreciated. And, we would ask the question about domestic violence and what was happening in the homes. Are we getting an increase in these calls? And the police chief in the city just answered, no, there's no changes. And, I don't think there's a problem there. The deputy mayor for, public safety said, oh, it's too early to tell. It's too early to tell. But my office and I have been getting calls from our advocates out there saying, our call volume has gone through the roof, for these emergency calls for domestic violence. And the fact of the matter is that they were trying to deny something that was a reality, not because they were bad people, but because they just had their mind focused on so many other things at the same time. And the challenge here, I think, for all of us, and I think this is a challenge in everyday life, but also especially during a crisis, is to make sure that you don't forget that, when you begin the day out, to remember the people that are going to be most forgotten, the ones that are going to fall through the cracks, the ones that aren't going to be caught in the safety net, and then start your day off there. And then you'll catch everyone else as you go through your day, in my opinion. And in this regard, I think people that are struggling with mental health issues, people that are struggling with in the home or in the community, are so busy trying to survive, so busy trying to make it through their daily life, that they need us. They need the government. They need our programs. They need our advocates. They need our community-based providers to step up to the plate and do more. And I think that's what we're trying to do now. We have finally gotten the government to admit that there is an increase in the District of Columbia of domestic violence cases. and therefore there needs to be more resources dedicated to these nonprofits and to the other advocates within the government who are working on this and trying to get support, trying to get places for people to go if they need to get out of their home. And that's just one example of all the places where we see people falling through the cracks that need our help.
We've got another comment and question that sort of are related to each other, and I think, again, don't have easy answers, but we'll see how we can do. There's a question about, along the lines of responding to the syndemic of infectious diseases and injection drug use, what are the current course requirements of cross-education for pharmacology, political science, criminal justice, and anthropology? I think course requirements, I fear the answer is we remain more siloed than any of us wish that we were. There's also a comment, though, about whether national associations should take a stronger role in setting national curriculum standards around policy analysis, social justice principles, and organizing. And Lily, I wonder if you maybe want to take a crack at sort of thinking about those issues writ large.
Actually, Devin, do you want to say something first about the syndemic piece?
Yeah, sure. So I see the student that asked that question is from LaSalle. First of all, go to paharmreduction.org, sign up, get engaged. LaSalle's in Pennsylvania. Number two, we've had a lot of luck with Jefferson University School of Pharmacy, Pitt School of Public Health, Wilkes University School of Pharmacy. We've said, hey, we want to train your students how to be advocates. And we do an advocacy training for them. It's like 3-4 hours. And we ask the university, just feed the students lunch and help us promote it. And maybe if you can, give us a couple of dollars. And we've had a really positive response to that. So, there are advocacy organizations in your community. Invite them in. They want to get connected to young people. There's never been a movement in America that wasn't, really supercharged by young people. Everything from, ending wars and so on and so forth. So we want to engage with young people, but having a partner on campus makes it so much easier. Be that lifeline to that outside organization. And check us out, PA Harm Reduction, Twitter and Instagram. Person from LaSalle. I'll come in.
Anybody else? Lily, yeah, please.
Yeah, I'll just say something about the so I totally think that the way to approach the sort of schools of public health thing is through the National Association. I will just acknowledge that sometimes those processes to influence decision-making at that level are so slow and it's like a campaign that you have to actually run over time and go to the national meetings and learn who the decision makers are. You have to do kind of a power analysis of who is it that can actually make this decision. And I will just readily admit that that's not something that our organization has made the decision to invest the energy in, because I think we like to, if we're going to run some kind of campaign of some kind, we want to make sure that we're doing it in a good way and that we're actually kind of able to stick with it for the long haul. And I think that organizationally, we have not been able to necessarily commit to doing that at the Association of Schools of Public Health. That doesn't mean other folks, I'm sure there's no doubt in my mind, there's mad organizing happening right now at that level to try to create more accountability to social justice principles. And I would love to sort of hear more largely from our public health community about what that's looked like, what the roadblocks have been. And I know, our staff have done some organizing around ending police violence at the American Public Health Association. And I know that that's taken years. And so I know this work can take years to actually shift attention to important issues. And I am readily acknowledging my own lack of knowledge about the organizing that has happened and the call to all right, what's happening? Please reach out to human impact partners. Let us know what the roles are. We can see if it makes sense to participate, because that is doing it through a centralized authority does make a lot of sense.
Great. Well, I'm pleased to say we have cleared the queue of questions. So I think what we'll do is take a closing comment from each one of you to wrap us up today. David, could we start with you?
Sure, sounds good. First, just let me say thank you so much for including me in this conversation. I often feel a bit like a fish out of water in these conversations because I don't have some public health degree or some knowledge of all the systems that need to change. But I will say something that Dior said earlier that I think is important to repeat, and I hope she doesn't mind if I do. the reality is that I need people to show up in person when they can. And you can't do that right now. So instead, send me a video, give me a call, whatever it is you need. Because when I'm making policy in the District of Columbia, having personal lived experience come in and testify about the issues that impact you is really, really important. I'll give one quick example in my closing. Last year, I've been working hard on a lot of issues around harm reduction, whether it be criminal justice or healthcare. And one of them is trying to decriminalize sex work in the District of Columbia. And when we introduced that bill, there was a lot of rancor. Everyone was upset at us, et cetera, except for the people that really mattered, that I listened to the closest, which were women and men who engaged in commercial sex in the District of Columbia and who have in the past. And they're the ones that wrote the bill. They're the ones that helped me advocate for it. And ultimately, I have to say the impact that it had in our city is not that we're going to all of a sudden decriminalize sex work in DC, but we had a public hearing. And that public hearing had over 13 hours of testimony. And for the first time in the District of Columbia, we had Black trans sex workers come to the city hall and testify and feel comfortable enough to do that. And I think what that tells you is that it's very important, no matter what you do from a public health perspective, to reach out to the community that is most impacted first and ask that community what it is that the community needs and what we can do as policymakers or as advocates or as agency heads or public health experts, whomever. What can we do to make your life better? What can we do to improve your access to care in this country and certainly here in my city? So again, I thank you for including me. I hope we can move this country to a place where we have better access to healthcare, better access to harm reduction policies, and that together we can save more lives. Thank you.
Thanks, David. I appreciate those comments. And I think they're a nice transition to asking Dior for some closing comments.
Yes, well, thank you again so much for having me. It's truly an honor to be among such amazing individuals, such hardworking people who are really making a difference. And so I'm very glad to be among you all. I think I've been hearing a lot about how people are taking this time to get everything done that they didn't have and weren't able to in the past, that now is the time to be productive and do things that, you just weren't able to do before. And I think that we really right now should just take the time to practice self-care, to really think about how we can take better care of ourselves, because there is never going to be a time where work doesn't need to be done. We're going to have a lot of things to do once this is over. And so I think we need to take the time to connect with people we love, to connect with each other, to see how we can be our best selves, and to see how we can really work together to solve a lot of the issues that are going to come up after all this is over. So practice self-care, take care of yourselves, just think about how we can work together in the future. And regardless of who you are, where you come from, you can make a difference when it comes to public health. I will always push lived experience. And so, again, just take care of one another.
Excellent comments. Very important on this Mental Health Day. Thank you so much. Lily, a few comments from you?
Yeah, I am not going to repeat all the things that I said before. I'm going to leave you with two very specific asks and actions that you can take. So one is you can go to publichealthawaken.com to sign up for our list and kind of track the actions and resources that we've been creating in response to this pandemic and beyond. You can also follow us on Twitter at PHAwakened. The other thing I'll just lift up is that there is a national campaign that's being led by Right to the City and Homes for All to cancel rent, cancel mortgages, and essentially ensure that renters, small businesses, restaurant workers, everybody isn't going to go back to a world with insurmountable debt, insecure and unsafe jobs, and detention and housing instability. And they are running a campaign right now and seeking sign-ons. And so if people just Google Right to the City or Homes for All, you can check out their Beyond Recovery Demand sign-on. So that is the kind of action that I'm encouraging public health people that they can take. It's as simple as supporting the demands that people who are fighting for housing justice are making. And I'll stop right there.
Great. Devin, a final comment.
Yeah, Power and privilege. Remember that you have the privilege today of, some of us have the privilege to stay at home. When you leave the house, you feel safe putting a mask on. Let me tell you, my black ass is not going to put a mask on and go outside. That shit is dangerous for me. And a lot of us don't have that power and privilege to do those things. And once you're done thinking about your privilege, I want to think about the power you have to be a change agent. We all have amazing power. A couple years ago, I was just a guy that wanted to make a difference. And I hustled and I got support and I made a huge difference. And each one of you has the ability to make a difference, whether it's joining APHA, getting more involved in your school, radicalizing the next student. Find something to do and make a difference. And when 5 years from now, you look back and say, I'm glad, and you'll say, I'm glad I did. Thanks for this opportunity.
You bet. I'll make just two final comments myself. One is, if you're out there and interested in engaging in conversation about things like mental health being essential to public health, I encourage you to engage with me on Twitter at Carlson Lisa M. And I just really want to say thank you. I want to say thank you to our presenters who took time to be here today, to all the people who are online who took time to be here today. And I think in this particular time, really want to just make sure that we say thank you to all of you who are fighting the good fight, because it is a good thing for us to fight the good fight all the time, but especially now. And with that, I'll turn it back to you, Dr. Benjamin.
Listen, I want to thank everyone for being on this amazing webinar this afternoon. As we think about the 25th anniversary of the National Public Health Week, and we think about the next 25 years, we have a lot of work to do. We very clearly have to rebuild the fabric of our society. We really need to demand a new social compact for health. Absolutely, we need to do that. This disease has exposed all the flaws and cracks in our system. We have an amazing country, but it has an enormous number of holes. And now's our time to fix that. And we're going to need to demand that. We need to come together, work together, and move together for a common agenda for humanity. So with that, I certainly also want to thank you. If you're not a member of the American Public Health Association, I encourage you to join. Even if you can just get involved with us on social media, get involved with us on our advocacy activities. Because I know things are tough right now for everybody, but be a part of us any way that you can possibly be. So that I will close it, end it, and give you back the rest of your day. Be safe. That's the most important thing, is be safe.